As the holiday approaches and Omicron cases continue to surge, many are scrambling to get their hands on a COVID-19 rapid antigen test for added protection this season. But how do you know if you're using them correctly? Well, joining us now with more is Khasim Ali Khan, Technical Operations Manager for BTNX, and that's the manufacturer behind the rapid response tests. Good morning to you, sir. Thanks so much for joining us.
Good morning, Candace. Thank you so much for having me.
So let's get started with a quick demo. How do you take one of these tests properly?
Absolutely. So when you get a rapid response COVID-19 antigen test, it comes in the form of a 5-pack or a 25-pack, 5-pack being the more common. All the tests required to do 5 tests are in this box. So just before you do the test, make sure you wash your hands. Lay everything, all the components required to do the test on a flat level surface. Very important to read the instructions for use. You get the leaflet in every pack, and then you also get a quick reference card. You can also use this to follow the instructions. Just to get to the test, it's very simple. You just have to start with taking the swab out of the pack, tilt your head, insert 1/2 inch inside, which is about a centimeter, rotate 5 times, pinch, twist the swab 5 times, do the same for the other nostril. And then after you do with that, you're done with the sample collection, put the swab into the tube with the buffer, squeeze 10 to 15 times, then leave this for 2 minutes unattended. And then after you're done waiting for 2 minutes, leave the swab into the garbage, put a nozzle onto the top, onto the tube, and then put 3 drops of this sample collected onto your cassette. When you put the 3 drops, wait for 15 minutes to do the result interpretation. The result interpretation is pretty simple. I have an example to show you here. If you see 1 line, it's positive, it's negative. And when you see 2 lines, it's a positive result. I repeat, 1 line, negative result, and 2 lines, it's a positive result, just like a pregnancy test.
Okay. Okay, good to know. So when is the best time to take one of these rapid tests? What's the best use for them?
Okay, the best use for using these tests, it's for screening individuals. So when you're symptomatic, you already know that you could potentially be carrying an infection, but it's also important to screen for the asymptomatic individuals for when they do not know that they could be having the COVID-19 and they could potentially be spreading it. So important is for screening asymptomatic individuals.
And how accurate are the tests? Are folks putting too much faith in them, do you think?
That's a very interesting question. So the tests are pretty accurate to catch the acute phase of the infection. Accuracy is measured in terms of sensitivity and specificity, and the sensitivity of the test is above 90%. When you're using the nasal swab, the anterior nasal, which I just showed. And it's above 95% for when you go much deeper for the nasopharyngeal swab.
I see, and I guess a lot of that would depend on the timing of when you took the test from the time you thought you were exposed and what your viral load is. But before we run out of time, for anyone planning to use these tests for screening around the holidays, back to my original comment, how long after taking the test can you meet up with other folks before the results become outdated?
Okay, so if I took a test today, I'd wait for another 2 to 3 days to do another test. And if I'm negative today, I'll go out to meet my family. I'll go out to see my friends. So Ontario recommends 3 to 4 days. I would revert to public health, or personally, I would say every 2 to 3 days, I'd repeat a test.
Okay, thank you so much. This has been very helpful, instructive, and I'm sure a lot of folks will take these tips into the holidays with them. That's Khasim Ali Khan, Technical Operations Manager for BTNX Rapid Response. Happy holidays.
Thank you. Thank you for having me. Happy holidays.